souvenirs.
Okay, I'd like to call the Madison County Health and Hospital Board Special District meeting to order at 12:13. We want to confirm the public notice. If you'll look, it's in your packet on the back of the first page. We do have a quorum, and we have no. Mr. Warren Irvin is not a guest; he's a regular member. Annette is here. She's also becoming a regular member, so we really don't have any guests today. We opened with a word of prayer before we ate, so let's have the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Warren, would you like to address the board?
No, I don't have anything. I'd like a packet if there's an extra one available.
Sure. Good. Thank you. Annette? She'd like a packet of that. Would you like to address the board in anything? Okay. All right. Since we do have a quorum, go ahead.
On my way over here, I was leaving the office. I had a veteran in, and I just want to mention this because sometimes show you how your intentions, people will misread things. And excuse my expression, but I said sometimes we're damn if we do, we're damn if we don't. I was telling this gentleman that I had to leave the office because I was coming to a board meeting down in Lee, and in the hospital board meeting, he says, "Oh yeah, they have it down there so that won't nobody know where they're at, so they can keep hiding things." I said, "God, oh, isn't that something?"
It is.
That's amazing.
Now we're going to address that same subject in a few minutes, but not right now.
And it's an extra burden on us to come out here so that we can move it around the county and share it.
Yeah, so
It's very
it took me a little time to try to explain to him what we were doing. We were moving around the county. Yeah, but his mind was already set.
As Claire Booth Luce said, no good deed goes unpunished. Also,
I call that the Walmart mentality.
oh, gee.
That hurt.
Or as Ron White says,
Okay. First of all, I would like to open the meeting and with a big round of thank you to Susan Young, who most of you know that this will be Susan's last board meeting. And she does a tremendous job for us, and she will continue to do that until next Thursday, which is your last day. Is that Wednesday. Oh, okay.
And then I'm passing the torch to Crystal.
Who better continue to do it?
But Susan, you have done a wonderful job for us. We really do appreciate it. Once you found out that I did not keep meeting dates in mind, you started sending emails to me and phone calls, and I appreciate it. And you've just done a wonderful job for us. Thank you for the minutes that you do.
Thank you.
They're done excellently. So we thank you, and now if you get back to work and
yes, I'm back to work.
do those minutes, we'll move on. There is a new item of business. I think it's business that I would like to add on B under business, and this is a discussion of a meeting with the Enterprise Recorder, Madison County Carrier. Okay. Now moving back up to item number 1 under business approval of the minutes for the Madison County Health and Hospital Board Special District meeting on May 26th. everyone have a chance to look at those minutes?
Move the minutes be accepted.
Have a motion?
Second.
Have a second? Any discussion, addition, or deletions? Not, all those in favor signify by saying aye.
Aye.
Item number 2, consideration and approval of the minutes of the district meeting on June 6th. This was the presentations by the proposed interviews by the proposed construction companies.
Move that those minutes be accepted.
We have a motion.
Second.
We have a second. All those in favor signify by saying aye.
Aye.
Opposed? Unanimous. Okay. Under business, item B, last Thursday, is that right, David?
I believe that's right.
David and I called and made an appointment with Emerald Green, the publisher of the Madison County Carrier and Enterprise Recorder, to discuss the hospital and the role that the hospital and the newspaper could perform for the citizens of Madison County. It was a very positive meeting. I want to report that. We discussed some of the articles that appeared in the paper, some of the inaccuracies in those articles, and we're assured that in the future all the articles would contain facts and nothing else, and that the newspaper would be checking with us to make sure they had their facts correct before they print the articles. As we went along in the meeting, the discussion turned to the opportunity to let the citizens of Madison County know what was happening with the hospital. Now, I know that some of us have had discussions with individuals in the newspaper, and to the extent that the board was being too secretive, that we were not operating in the sunshine. And that led around to an offer by the newspaper to publish articles written by us in the newspaper. Actually David. There will be a series of articles that will be answering questions. The first article will be published next week, and the question is, tell me what the question is.
Why are there two boards?
Why are there two boards? And you will be seeing that article in the newspaper next week. In addition to that, the newspaper reserved the right to ask questions about the article, and David will respond to those questions, if they have any questions. Some of the other items will be what is the real financial feasibility of a new hospital for Madison County? I can't remember.
It's kind of limited by, well, it's only limited by your imagination, really. I'm actually looking at this as an opportunity to keep the ball rolling, because they publish articles. What I'm trying to say is there's been so much misunderstanding that if they publish the articles, it'd be to our benefit to have as many articles as possible and just keep them rolling. It's an educational opportunity. So trying to list out what those articles will be, who knows? They'll just continue though. There's just so much that the public needs to know about healthcare in Madison County.
Oliver said earlier, there's so much misinformation.
Right. Now, the other side of that is something that the board discussed several months ago, and the consensus of the board was that we needed to move forward on some advertising in the paper, and we discussed that. There was absolutely no pressure from the paper, from Emerald's point. It was a very positive discussion, but it is my opinion that still that we need to do some advertising in the newspaper. For example, Dr. Stockwell. We really need to get the word out, because there are a lot of people that don't realize that they could get those procedures done here in Madison at the hospital. In addition, I understand there's been a change in the Blue Cross Blue Shield
Right.
coverage on that, so I'll let David address that.
Well, I don't know a great deal more than what Ben just said, and that is that we're moving to our employees are moving to a different healthcare provider, or excuse me, a healthcare plan, and that's Blue Cross. So that'll be taking place soon. There is further information on that. I'm sorry to say, I just don't have that information. I'm just not knowledgeable of it at the present time.
But what I had heard was that the Blue Cross Blue Shield had been, their deductible, copay was pretty high for these procedures in a hospital, but they have changed the way they look at it, and their copay will come down, and they will be okay with a hospital rather than an outpatient situation like they have in the past.
Well, that might have been a problem all along. I'm sure it was, because people don't want to pay that high.
Well,
It has been a problem, because I've got Blue Cross, and it would have cost me
$500.
it would cost me $300 more than it cost me to have it done at the hospital. And it was the same with Vista when we had it, but I'm in the process of renewing our hospitalization insurance now, and I'm getting into those deductibles, so I'll know also within the next week what the story of that is.
right. Now, that's not official. I had just heard from a pretty reliable source,
My
like
first
an insurance
blush,
agent.
my first blush in looking through it, I didn't see that, but
Okay.
that's something I'll be going through, so
Uh,
that would be a big benefit for the people in the county that do have
insurance.
insurance
Yeah.
to be able to get it done here, because, quite frankly, it's inconvenient for the rest of us to go traipsing over to Tallahassee to get our procedures done. And I'd rather have it done with Dr. Stockwell anyhow,
Right.
because he's better than anybody that's in Tallahassee.
In addition to that, that's, if that is the case, and we will be able to collect insurance for those procedures. And right now, a lot of the stuff that we're getting is Medicare or Medicaid. Medicaid, if you remember the discussion about that, we lose money every procedure, and I mean substantial amount. So this could really help the financial end of that. Any other discussion on that subject? David, can you think of anything else that we need to cover on that?
On that subject, no.
Okay.
Welcome.
So you will see an article next week, so keep your eye out for it. Okay. Any other items under business?
We've got the architectural review updated. You want to do that? And I've got an item of business I want to bring up under this one also.
Yeah, don't have anything to say about ACA. However, regarding the architectural end of things, we're moving right along. We're right at the end of the floor plan schematic part of this. We tied up a lot of loose ends this week. Yesterday we met with the CRA representatives, and things are going as they should. And a lot of loose ends are tied up, and we're proceeding on. And to the best of my understanding, we're essentially on target time-wise. So we're on the timeline. There's another little aspect to this I need to mention. The city of Madison called the other day and said that my name is on a form they have, and because I'm not an employee of the district, I'm an employee of the corporation, they need a letter from the district saying that I'm a representative of the district as it pertains to that form. So I need to ask the board if they would consider making a motion and entertaining the concept of appointing me as a representative of the board for this particular purpose for the city.
I move that the secretary be directed to draft such a letter that would designate David Abercrombie as the representative of the district board for dealings on this matter, and that it be properly signed by the chairman. Second the motion.
Have a motion and a second. Any discussion? All those in favor signify by saying aye.
I had an item of business I would like to bring up, and it's,
Annette, good to see you. Thanks for making, you get caught in the construction too.
Yes.
traffic jam in Lee.
And Madison.
I'm sorry, Howard.
No, that's okay. This really is under business action items. It's also somewhat unfinished business because it's something we've discussed before. And we're at the point now where I think the board needs to decide and take action. We have discussed in the past that building the new hospital is time for a possible fresh start as far as renaming the hospital. There's really nothing wrong with the old name, but I think having the new building, we could come up possibly with a name that would be better suited for the citizens of the county. Also, the Madison County Hospital has a connotation that this is a county-owned hospital that is there to give the indigent care, which is one of our big problems, which of course we have to do. But in a way, that is a political stigma on the hospital. So, and our board attorney had made a few suggestions on maybe having a contest with the citizens in the county, putting up a small cash prize, which I think there would be some of us that would be willing to come up with the money to fund that so that it wouldn't come out of our meager coffers. And that we go ahead and proceed with a published contest with a date certain for the entries to be turned in for citizens of the county to submit suggested names for the new hospital, but that it be at the sole discretion of the board to determine if one of those names is appropriate, and or if there is not one that would be appropriate, we would keep the same name. Along with this, and as part of the motion, I would move that, based on deciding what area in the hospital, that we do name possibly administrative wing or training center or something like that for Mr. Charlie Moore. Charlie was a long time friend of this hospital. He served on the board for many years. He was in the forefront of the program to raise or to get the sales tax passed. I mean, he worked tirelessly on that. And even after that was over with, he continued. He served on our financial board when we were looking at whether to bond or to go with USDA. So I think if anybody over the long haul has been a part of this hospital and has given of themselves, it's Charlie Moore. So that's also a part of my motion.
A motion on the floor. We have a second.
I second.
We have a second. Okay, discussion.
I think it's a great idea about including the community and the county in the name. And depending on when you decide to start running with this, if it was like latter part of August or so, I would even suggest putting it into the schools, into the elementary schools, and then the classrooms could turn it into a class project. They could do a little research into the hospital, the history of it, and let the kids either as an individual or do it to where it's a per class, come up with the name and submit it. I mean, you can get some really good PR started from children.
That's a great idea. And if we started around that time, we might have this done in time for the groundbreaking, which would be the great time, which is not scheduled for October, tentatively, and that would be the great time to announce the new name if we're doing it.
It hasn't been voted on yet, just continuing the thought process a bit. How long do you think the project should last? the contest should last a month. I mean, if you don't want to overdo it either.
I think a month would be ample time.
Months long, maybe 6 weeks at the most.
Well, if that were to take place, and if the board were to vote in favor of this and you choose a new name, that would work out pretty well as far as groundbreaking, because there'd be a big sign up there and have the new name on it, coming soon type thing.
Just a question about it, and I don't know the answer to this. How would changing the name impact anything with
Right.
Ages for Healthcare or USDA or bonding or anything like that?
We've had that discussion, and here's the way we think it will impact. First of all, there will be a certain amount of cost involved, and that you have to change letterhead and all that. Now, we are a year and a half out from having to change letterhead and business cards and all that kind of thing. There's that. As far as the actual name, we could just change out the DBA because it's under the corporation.
That's all we have to
We wouldn't change the names for the Department of Agriculture
Okay.
or
It's just the DBA.
Now, there's one other thing too, and that is with Medicare. Medicare has kind of a ponderous change of information requirement that can go on for several months. So that would be something we could begin working on in advance and get everything exactly right. They actually do send things back when a comma is out of place. They actually do. We've had one situation where it went on for a year, trying to change a simple thing like someone's name on the form. But
That's true, but we're gonna have to file that anyway when we get ready to move to the new facility.
that's right. We got to file anyway when we change our location, so it wouldn't affect it any more than it would.
It just makes it a little more complicated for them to handle, which I'm not sure they can do.
Blow their mind. But to answer your question, it's primarily a DBA change.
Have we decided how we're gonna disseminate the information as far as the contest? We talked about some things on Saturday, put them in the mailbox, or since we're gonna do something with the paper now.
Well, I think it'd
We
be
got
very
the paper,
appropriate.
we've got the paper, we've got the Madison Voice, we've got the Chamber of Commerce newsletter. The form could be put in all of those. It could be with the article in the paper. It would be easy to stick on the Voice and to put on the Chamber's newsletter that comes out. And then with Annette's suggestion, we put it out in the schools and the classrooms. And we could solicit any of the businesses that would like to put some of these in their lobby for people to pick up and vote. And we just need to announce on there a couple of central collection points for these to be turned into. I think that's something, once if we decide we're going to do this, then, staff can work on that. And I'd be glad to work on that project as far as putting it together with David and hospital staff.
I think it's a fantastic idea. I think it'll bring a lot of attention to the hospital. A lot of people will start thinking about a new hospital. I think it's perfect.
And it's another thing too, it's an opportunity for, and that is that, today we're sitting in Lee, and one of the reasons that we're doing that is an effort to include all parts of the county in the workings and understanding of the hospital. This is also an opportunity that when a name is chosen, make sure that name is representative of the entire county and not just to be perceived as a city or a county, a city of Madison fame, just because it happens to be located in the city.
I just feel it's a really good opportunity to get some positive
Mm-hmm.
going
Oh,
on
yeah.
with the hospital. And when
Absolutely.
you start getting out into the community, the people that don't feel comfortable coming to the meetings and don't feel comfortable going up when the county commissioners have their meetings, this is an opportunity for them to feel like they have a little bit to say about it, and
Right.
just a little bit of positive. It's just like anything else; it'll spread, and I think it'll be a really good thing for the hospital and for what's going to be going on over the next 12 to 18 months.
just talk
talking about a cash prize or whatever, you want to make sure you have some pretty clear ground rules, so, you know, there's not some confusion about how many entries per person, or if the same name is nominated by multiple people.
Well, you weren't at the meeting on Saturday, and we did have a proposed form to send out, and one of the things in there was that if people submitted the same name, there would be a drawing to determine who gets the prize. It would not be split, but it would be one prize.
Our attorney's actually already worked on that form, so
Okay.
it should meet legal muster. If it doesn't, it's his fault.
And why do we care how many they submit?
We don't.
I don't care.
What kind of cash prize are you talking
Whatever
about?
Howard donates.
We're talking about around 300. I mean, it's, you know, it shouldn't be a real big cash prize, but we did want to give something. And Kerry had suggested $300, and he says he knows where to get it.
Well, if you don't, I mean, this is just a thought, but if you didn't do per se a like actual $300 cash prize, what about hitting up some of the businesses in Madison for like gift cards, maybe to grocery store, to gas stations, to
Busy bee.
convenience stores, throwing out any names, different things like that, you know, even to some of the automotive, I mean, to where that's another way you'll be getting other businesses involved in that.
What could,
Could still come up to $300, but I mean,
you give us like a basket type thing, then have these gift cards, like you're saying, this basket from various businesses or something
Right.
like that, equaling X amount of dollars.
That sounds good.
And then
Would you be willing to take on that part of the project?
Sure.
And
be happy to.
okay, you're now our fundraiser
No.
for this.
Is that on? Because I'm not the fundraiser, but I'll be happy to do the.
Well, just for this
I
one
just think that's a
project.
good way to get, you know, more of the
Good idea.
community involved in the actual
I agree.
prize of it.
Great. You know, I mean, who doesn't want to eat a
And it
nice
could end up
meal at
being
the
more than
Mexican
$300
restaurant
that
downtown,
way,
you know?
you know? You have, and then,
Or the other Mexican restaurant.
yeah,
Or both.
they're both good.
Or Shelby's.
Or Shelby's, yeah.
Or
I
Burger
think
King.
Or Burger King. Like I said, I'm not throwing out any names.
I think they're going to come out with
And I'm
more
sure
than
I can-
$300. I think they're going to
That's what
have
I mean, that
a
way,
lot
and
of
then
value.
when that happens, I mean, you could even advertise that part, you know, prizes, and then, you know, have a list of the different businesses that are offering prizes, because there again, that's positive for the hospital, because other people read that and they're like, oh, well, you know, this business is supporting it, and this business is supporting it.
I'm sure I can come up with a savings bond.
See?
And we can even sell advertising for the newspaper, because all these businesses that are participating can put little, you know, the little small ads supporting renaming the hospital, you know?
So now, I'm not sure, though, how that would work, per se, like, with the schools, like, with, like, an individual, I don't know, with the schools, I don't know if you want to do it, like, as an individual thing, or do you want to do it as a class thing? If you did it as a class thing, like a class submitting a name, then we could do just like a class party. You know, they could have an ice cream social, or a pizza party, or even perhaps, if it's with the public schools, an outing where they actually, we would pay for the gas for the bus to actually take them somewhere, whether it be, you know, it gets really, I mean, the poor public schools, they can't do anything unless they've got money to, you know, have a bus to take them to and from, and stuff like that. So, I mean, that's something to, because I don't know necessarily how a child, if they win the prize, is going to, like, you know, rotating your tires, or, you know, $25 worth of gas. I mean, their parents might really like it, but I don't think their child would like it. But if you did it as like a class, you know, each class submit a name, then we could offer a prize to the class
Right.
as a whole.
I'm so excited. This is the first time we've had a real positive idea session in a long time with the board. I'm excited about it.
We've got a little bit of time on this, and if Annette could work on bringing those ideas back in sort of a formal fashion for the next meeting, which would be the July meeting, that's plenty of time to get this rolling before school starts. If we're going to put it out.
Why do you want to bring it back full board? Why don't you let her and Vicki and David get together and work it all
Absolutely.
out.
That's the way I
Well,
feel
that's
about it.
fine.
Do
So
all
like I
that.
say, just do it.
Well, let's, I call for the question on my motion. Let's
Okay.
get seconded.
Let's, can you read the motion back, Susan?
Good luck.
I wouldn't want to have to reword that motion. That's the longest motion I think I've ever heard.
Discussing with the constable and a new name, and a motion made by Howard and seconded by Oliver to request that the name of the hospital be done using the community in the form of a contest, and also to name a wing after Charlie Moore.
There was something else.
A wing or some
Or
part of the
something.
hospital.
Some aspect of the hospital.
Or other.
Call for a question.
All right, question to call for. All those in favor signify by saying aye.
Aye.
Opposed? Unanimous.
You know, it would be kind of neat to have an administrative wing named that. It would be, but that's just my opinion.
The conference room, or, I mean, there's a lot of different options.
Well, the administrative wing runs right down into the conference room, and you could put a sign as you go into that area.
Keep in mind, back in 1999, Charlie Moore was actually leading the pack to get the hospital rebuilt, or a new hospital built. And that's really when all this began, about 1999. Charlie Moore was holding the reins at that time.
And one of the last things he did, he went to Homeville with us to look at.
Yes, he did. Hospital.
All right. Howard, did you have another, or were those the two that you had combined?
That was
You said
two
you
we
had-
had combined. We did have one other thing we talked about Saturday.
Diving? What?
Yeah, well, we talked about, that was after the meeting, we talked about diving. Was about starting to get the information on costs, like what it will cost to redo a room,
Oh, yeah.
this, that, and the other.
That
Yes.
is that's underway now. We're getting some cost underway now. It'll take a couple of weeks to get that, but I will have it ready.
What we're talking about is perhaps allowing somebody to furnish a room and have their family member's name on the door or whatever, like we did in the old one. And by the way, David is also planning on having a wall of honor of all the names and the rooms that were named for people, take those plaques off and put them on the wall of honor. So those will not be lost. We'll still have that history of the people that furnished the rooms way back, when the hospital started. Okay, David?
Under unfinished business, I just wanted to let you know that Culpeper Childers has been notified that they have, that the board voted to begin negotiating contract with them, so we'll see how that works out. We're very happy. So,
And you have also provided the information on that to USDA, and they're reviewing that, is that right?
I have. They require that they concur with the choice of the contractor. If that information has been put in their hands, we'll be expecting a letter back from them anytime. I don't expect any problem whatsoever, none whatsoever.
Not from the number of USDA projects that particular
Yeah.
contractor's worked on.
Right.
How about the reference checks?
Reference checks, as you can imagine, if you give references, they're going to be good references, and all of them were outstanding references.
So we're waiting on the USDA to say, yep, you can go with them and start negotiating.
We're waiting on that, and we're also waiting on Billy Rutherford to get back in town to assist us in putting together the criteria for a contract to be negotiated.
Gary?
One other item, you never know who helps you on these projects, but I have a feeling that Warren has helped us a good bit on this project, because the county commission has been looking for some money to give us on a recurring basis for indigent care, and that's coming to fruition now. They called a meeting for next Wednesday night at 6 o'clock, and we need to have a crowd there. The vote looks like it's 2-2 with one swing vote, so we need to really have a good group there. What this is the county has 1 cent sales tax, half of which goes to the EMS and half goes to the project down on the highway, water and sewer to the interstate. they found a way to refinance that half cent to the water and sewer thing and get us about $250,000. This would be no new taxes for anybody, just the same tax. And they could give us $250,000 a year. The procedure is they have to vote to adopt, to instruct Tommy to do it. And that's what they plan on doing Wednesday night. And then at the next regular meeting, Tommy would present it and they would vote on it at that time. So we need a lot of folks, a lot of support showing that this is a worthwhile project. One of the problems they have is that the chairman doesn't like the idea of the staff telling her what to do. So she wants to have the meeting next Wednesday night at 6 o'clock. The staff wanted to have it at a regular meeting, so it didn't look like they were hiding something or something like that. But it looks like it's going to be like, right now, it looks like the commission may meet next Wednesday night and vote 4-1, not to consider it, then to consider it at the next regular meeting, which would be a terrible thing, but it's the politics on the board. Hopefully, everybody will get, if we have a big enough crowd there and everybody's in support of this thing, they'll go on and pass it next Wednesday night and we'll be done with it for the first time.
That's 6 o'clock.
6 o'clock.
It's really important in a couple of ways that this is happening. It's the first time that I'm aware of that anyone outside the hospital family has acknowledged that and that Madison County has a huge amount of indigent care, and that needs to be addressed. The problem needs to be addressed, and not just kind of left to the hospital to deal with it. $250,000 is wonderful. Keep in mind also that we'll continue to deal with right at $3 million of uncompensated care. So it's still a huge problem. The $250 is sure a step in the right direction to get this done.
It shows USDA that the county is invested in our hospital.
It certainly does.
Important also.
And that's also an opportunity. It's an opportunity to take that, I want to call it a goodwill gesture, take that gesture and try to capitalize a relationship with the county and try to forge a stronger relationship.
And one other thing I didn't mention was, just by interlocal agreement, this tax is, so once the county passes it, it has to go to Lee and Greenville also to be passed. So,
Well, this will go a long way with USDA and everything.
I've got a question for the attorney.
But before he asks this question, I think what you said is really important. Thank you. Really appreciate it.
Absolutely.
It kind of goes to show what can happen when citizens do get involved. Thank you.
Do you think being, I know they've tinkered with this 1 cent sales tax over the years, but being you're really breaking a new direction with it, do you think that by statute it has to be put up for a vote of the collectorate?
I don't believe it does. You know, it actually was passed with jail.
Correct.
And then they tinkered with it and
Yeah.
changed it around without a vote. I'd have to go back and research that, but I don't think it does.
Okay, I wondered about that. I thought maybe it would have to go for a vote.
I don't think it does. I think they could just do it. But the county commission and the 3 city commissions, I forgot Madison, all have to approve the change in the interlocal agreement.
I'm thinking my read of this, of the county commission, is that they may want to put that up for a vote.
That'd be terrible.
That would be my opinion. That's the feeling I'm getting.
That takes a long time and expense.
No, you could call a special election. I don't know how much time that takes, but.
Well, you know, I hate to say this, but we had a free airport given to us and we turned it down by a vote of the people. I just think that might be a killer.
I just wondered what the statute said on it.
Yeah, it doesn't have to be a vote.
Okay.
And I sure hope they don't do that. Okay, that's all I had on it.
Any other discussion?
So Vicki, get everybody there.
Okay.
And
Mary Ann Green's a strong voice, right
Yeah.
along with this
And we
wonderful
need-
man sitting here.
And we need a lot of just good citizens
Yes.
there, not necessarily hospital people, but
Right.
good people there.
That was a wonderful article Mary Ann Green wrote in the paper.
Okay. Any other business for the special district meeting? If not, I'll entertain a motion.
So moved.
Motion, second. Second. Those in favor of adjournment, signify by saying aye. We're adjourned. Okay. Now we'll move to the Madison County Hospital Health System Incorporated Board, the corporate meeting. And let's adjourn that. You got it? Okay. Okay, we'll call the meeting to order. We did have a public notice we'll send out. We have a quorum, and we have two regular guests, Lauren Irving and Lynette, rather. Sorry. Moving along, item number 1 under business, the minutes from the Madison County Hospital Health System corporate meeting, May 26. Has everyone had a chance to read those?
Move to approve the minutes.
We have a motion.
Second the motion.
We have a second. Any discussion? All those in favor signify by saying aye.
Aye.
Opposed? Unanimous. Okay, under business, item B, ongoing projects. Move forward, the endoscopy program. David, I assume Tammy's going to address that?
Yes,
Okay.
you're aware that we're doing endoscopy procedures every other week in our procedure room at the hospital. Going well. June 14th, we had 7 procedures, and the next scheduled date is June 28th, next Tuesday. We have 10 procedures scheduled. Yeah, 8 patients, 10 procedures, and then already we have up for July, the next schedule, 5 already scheduled. So numbers are increasing. So I think an article in the paper and an ad for Dr. Stockwell would be great to boost that program number up. That's all I have to say about
Okay.
endoscopy.
We didn't
Swing
get
bed
any
program?
response from the admin Christian.
Not yet, no, sir.
Swing bed program? We have
Yes,
good
swing
news.
bed. Wow. Got there this morning. We had 10 swing bed patients in the hospital. Total census was 14. Thanks to Dr. Perkins and Lucy, they have really been helping out with the swing bed program. And as of 6 o'clock this evening, we will have 11 swing bed patients.
Right.
Attaboy.
Birmingham, Alabama.
And
Yes.
that one from Birmingham will really keep the nurses jumping down there, I'll tell you that.
That's all I
Dr.
have.
Perkins, we really do appreciate all your hard work on this. Thank you so much.
Yes, sir.
He's extorting $2 a patient from me.
As they said, we got to 13 and hell there, it's $2 a day to buy me a cheeseburger.
Yeah.
I thought he was going to say $2 a minute per
Yeah,
patient,
absolutely.
per day.
But it's only a mini stack. It's only a single stacker.
Whatever $2 a buy.
We have to be conservative. But you can get a double stacker for $2.
Yeah.
Yes. Okay. Any other discussion on those two items? Foundation, David?
Thank you. As you know, we have 4 board members on our foundation. We have a slot for 7. So we have 3 vacancies. Last week, Kay Harris submitted her resignation. She has just a little bit too much on her plate, and she's going to be unable to continue with that, so that drops us down to 3. I have her written resignation. We'll be turning that into the foundation board. I think we'll probably be meeting on Monday. She is always there if we need her, though, and she's a good friend to the foundation. After some discussions how funds could best be raised through a foundation structure, it was decided that we would develop a request for proposals to send out to various fundraising organizations around the region, in Gainesville, Tallahassee, and so on. So that will be going out after the board approves the request for a proposal, so it'll probably go out within 7 days. And the idea is to select an organization or a business that does this professionally and let them have the lead and follow their lead.
They would be compensated based on what they raised.
Yes, generally that would be part of it. There's another thing I'll mention, I'm not so sure where this will actually go, but the board, when I say the board, we're talking about the district or corporate board here, but we're all part of the same family, so I'm going to say we. We really haven't done that great of a job over the last year and a half when it comes to selecting board members. We've been dilly-dallying around here, there, and the other. We've looked at different ways to approach it, but the end result is it just hasn't worked. This corporate board here has held to itself the authorization to appoint board members to the foundation. What do you think? Don't you think it's time we gave it up and just gave it back to the board and let them select their own board members? I mean, it's been a year and a half. We got 3 members. Maybe people that they can work with. What do we want? Just continue on with 3 board members. It's not working, folks.
I almost feel that it's better to let them work with whom they feel they're going to be able to get the most accomplished with and work well with. I mean, we can throw names out all day long, but if it's not somebody that they're going to mesh well with, and, you know, that's a volunteer position, that's a lot of hard work, and if they know somebody that, because, you know, a lot of times I could approach one of my friends and say, hey, you know, if I know that they're on board with something, you know, how about helping me with this or whatever? And they're a whole lot more inclined to do it for me because, you know, of a personal relationship than they would somebody that, you know, oh, no, I really don't have time for that, and, you know, I don't really. And I think that way they could come up with a group that would mesh well, work well together, and, you know, really be beneficial to the foundation.
Any other discussion?
I really think a professional fundraiser would be the answer, because I don't think any of us have had any experience with fundraising of this magnitude. We're just kind of floundering. We need some direction.
Well, I think that's a good decision for that board to make, but I also feel like it hasn't worked. As far as the number of board members we've had there, it's been hard to get meetings together. And if we've got a good nucleus of 3 now, let's get that 3 to work finding the other board members and
Well,
let them
we're
make
actually
it from
talking
their
about
ranks.
2 separate things here.
Yeah.
One is we're talking about whether this board will allow the foundation board to select its own members to fill vacancies. The other thing is whether it's a good idea to go out to a professional fundraising organization to lead the way in fundraising.
I think that's a decision for the board of the foundation to make.
And it needs more members.
And it needs more members. That's why I said that, you know, that's sort of not a decision for us to make, but how we want to handle staffing the board of the foundation is. And I agree, it hadn't worked this one way, so if we've got a nucleus of 3, who are our 3 remaining board members now? Tommy, Jimmy, and Vicky, okay? Vicky, Jimmy, can y'all find 4 more good board members?
Well, we hadn't had a whole lot of success getting people on board. Everybody is just so darn busy, but say if you want something done, give it to a busy person.
There again, too, I think if when you are approaching members to serve on that board, if they know that you guys are going to be enlisting the help of a professional fundraising firm, it makes a lot of difference, because you're talking about a lot of stress headaches on the fact that, you know, the kind of money that they're thinking they're going to have to on their own come up with. And I think a professional, you know, fundraising coming in would be immensely beneficial to that board, and I think it would relieve some of the pressure that they would feel as, you know, what their obligations are, and might be what's needed for somebody to say, okay, yeah, I'd be happy to.
And really, the timing is kind of about right. Send out the RFP, it'll take a little bit to sort all that out. At that point, we'll be just about ready to break ground on the new hospital and raise the energy level there. It should be easier for the foundation members to find other board members, other foundation board members to join. Then they will know they don't have to raise funds themselves.
Do we need a motion to that effect? I so move.
So moved. Have a second? Have a second, Randy. All those in favor signify by saying aye. Aye. It's unanimous. Okay. We will, David, will you relay that information to Tommy, who is chairman of the foundation right now?
It's done.
Okay.
We'll do it.
All right, moving on along, financial. Patrick, give us good news.
Well, our collections have been better in June. Obviously, June 1st, we got our updated Medicare rates. We should start, we've probably gotten some of that money, start collecting on that, but we're still collecting May money. So our rates, we haven't seen the positive yet of the rates, but we have seen increased cash collection. We're starting to bear the fruit from Dr. Perkins and Lucy and all their hard work over there, getting the increased patients.
Patrick, I'm not real sure I remember the exact number, but you might. If we were to apply those increased rates to last year's volume, what difference would that make? Do you recall that?
And we did so many different analyses.
Well, I believe it was in the neighborhood of about closing in on 300,000.
I was thinking around 300 to 325,000.
So we've got these new rates now, and if this were to have happened a year ago, it would have been $300,000 more. So if we can have that same volume or better, Dr. Perkins,
No pressure, no pressure.
then they may make another $300,000 plus.
I'll buy you a bag of French fries to go with your Coca-Cola.
I'll throw in for an icy.
Actually, I think the 300,000 was what we were kind of ballparking. If we would have had the rates starting October 1st of this current year through the fiscal year, so that was actually only over a 7-month period.
Yeah.
So if you
I
apply
need telling board members that.
Yeah.
Let them think that 200 to 300, and if we deliver 5, it'll just make us look like heroes.
Trying to make that clear, but other than that, in the balance sheet notes, we've got should have all the updated planning or scheduling out of the long-term debt as far as short-term, long-term with Craneware and health plan. We should have all that pretty current. Other than that, unless people have questions, that's pretty much all I've got.
Yeah, you got down here, the final balloon payment, NES, is on August 1st. Our next board meeting is July 28th. So you might mention that a couple of days after the last board meeting, or the next board meeting, that our monthly payments of $7,000 to NES will go away.
Yeah.
That'll be good.
So yeah, we've got one $7,000 payment left due by the end of June, and then a $2,000 payment due before August 1st or on August 1st, so we're almost done with NES.
Any other questions from board members? Patrick?
One more. Go ahead, Warren.
Yeah, I just wanted to ask you, with the type of accounting you do, as far as the time frame goes, what's the difference between like short-term debt and long-term debt?
Short-term or current portion of long-term, that's your long-term debt, your loans. It's the portion of that loan that's due within the next 12 months. So whatever principal you got to pay on those long-term loans that are due in the next 12 months, you move up to your current, because current's everything.
That payment will be short-term then?
Right.
Okay.
Everything paid within a year is short-term, after that is long-term.
Okay.
And that's GAAP, generally accepted accounting practice. Everyone is supposed to show short and long-term that way.
Okay.
And that's kind of why on that balance sheet notes, I do a totals at the very bottom, So the total long-term debt, even though a portion of it is short-term, I want to show what our total on that long-term debt is. Just a categorizing thing, but I wanted to show that total on our notes and.
And Patrick, I think you told us before that maybe around November we should get our increase in Medicare rates due to having the new electronic medical record system in.
That's the general line that we're getting from the different sources. Everybody's got their own opinion of it. Even within Medicare, there's some varying opinions. But sometime in October, November, December, they're going to start paying the bonus money out and all. Some of the state Medicaid programs have already started paying out and paid lump sum payments. Hospitals over in Louisiana, there's a handful of them, got $1.5, $1.6 million, and they've got the total package of it already. Florida's not doing that, so we don't even get the hopes up on that. We're going through Medicare to get it, but it is, it's a lot of it's still until we get some actual money in hand. I won't be surprised by anything, but that's what we've been told is sometime by the end of the year we should start seeing that money come in.
And the new depreciation on our electronic medical record system, the whole computer system, all that has not been put into our cost report yet.
No.
So we've still got additional Medicare step up to get.
That's where it gets tricky now. It could be included in those bonus payments we get for 5 years. There's some difference of opinion on that as well, whether we can take the depreciation and get the bonus increase in reimbursement. So, it's some of it, it's still up to speculation, I guess, a little bit there.
So it could be an either or thing.
It could be an either or thing.
I like the both apps are better.
Yeah, me too.
We'll see. I'm hoping that's going to work out. Our cost report lady was looking into it. Like these hospitals that all got the 1.6 million, 1.5 million, they won't get any 20% bonus from Medicare. They won't be able to get depreciated on their cost reports.
Still take $1.5 million.
You aren't kidding. I take that money and
Take it and run.
big smile on my face. So we just got to see how it works out. If Medicaid and Medicare are spreading it over 5 years, we'll probably get the bonus and the depreciation all rolled into one over that 5-year period.
Any other questions for Patrick? If not, we'll move into administration. David?
Really don't have anything to say. Yes, I do. My report isn't here. You can read it at your leisure. You probably already have. There's something I need to mention that is, I neglected to mention it in the district meeting, but what I say here in corporate is applicable to both district and corporate board. And that is, as you know, we have Howard rotating, or his term expires June 30th of this year. Also, Reverend Bradley's term expires June 30th of this year. And we're still waiting for action on Jim Sales' term and Margie McLeod's term that had expired last year. Today, Susan called the state and asked them about this, and I'm just going to ask her to repeat what she's already told me.
Basically, in a nutshell, they recognized that they're behind, and they said that the hospital boards are very important to the governor. However, please allow for this lag time. I think what they mean is when they reappoint people to handle their appointments. I did go online and look over the appointments, and there are several that they've done, but they are selecting ones more like college boards and water management district boards and things of that nature. So it looks as though hospital boards are kind of, few and far in between that he's appointed. board members too, but they did say to look for some things to happen in the next 2 weeks, but no promises.
And also mention too about continuation.
Oh, and that everybody is to continue in their places until they are replaced.
That is by statute, by
That
the
comes
way.
right.
That is by statute.
So as far as they're concerned, those same people that are on that list right now are in that same spot until a person replaces them.
Well, I will announce that I'm reapplying for mine.
Excellent. Do you have an application? I'll look that up.
I need to get an application. I think Oliver's in a hurry to also.
About a year ago.
You've already turned yours in and they already have it in their office. Okay.
So,
Tax dollars at work.
And Margie chose not to reapply. Is that correct?
but there is another application that is in.
Yes. She chose not to reapply, but someone else has applied for that position.
Right.
So they currently have 2 applications sitting there, and when June 30th rolls around, they'll need 2 more, I guess. And we'll just do our part like we're
We just need
supposed
to
to.
send those in next week.
That's really good to know because also our invoice for paying bonds is due now, so we need to know what's going to take place. That's all I have.
Okay. Tammy?
Our report is on page 3B. I'm sure you've all read it. I finished this report around June 8th, and if you saw the spring bed census at that time was 5, we're up to 11. Again, I just want to emphasize that, wow, amazing what can happen in 2 weeks with those numbers. And I can't thank Dr. Perkins enough. That's all I have. Any questions? Thank you.
Thank you.
Okay, Cindy's not here, so David's going to handle that part.
And there's really not much to say. If you look at Exhibit 3C, you'll see Cindy's Human Resource Report. It has been remaining pretty constant throughout it all. There's not really anything to point out. This past month, we've had 84.1 FTEs against last month, 84.3. And this month, year-to-date, 82.7. If you look at the payroll, you'll see it's running pretty much an average from last year, a little less than last month, and just a tiny bit more than last year. Net payroll, same thing, it's following suit. Average salaries are pretty much the same. It just continues on and relatively consistent.
Vicki, you have anything you want to share with us?
Even though it's summer, a lot of city clubs aren't meeting, we're still in contact with everybody, so everything's going very well.
We look forward to that big crowd that's going to be there next Wednesday night.
Okay.
Thank you.
I'll start working on that right away.
Okay.
We got to talk.
Okay.
Dr. Perkins?
Well, the biggest thing I can mention is we had a visitor, David Robinson, come over and met with David. He's an internist at Southern Medical and was head of hospice, chief medical director, who's very interested in coming to Madison to practice medicine.
David Robinson?
And
He's a
David
fine
met
young
with
man.
him. You know him?
Yeah.
He grew up in Tallahassee. He's
Right.
nice fellow. He's very interested. He's made it apparent that this is one of the places he's interested in possibly coming out and working. That way, so he can tell him more of what he's thinking.
First of all, I think people in Madison would go crazy over him. He's a very personable fellow.
He's a wonderful personality.
He's an internist, which is extremely hard to find. We need an internist, especially if we are able to put into place our strategic plan like we talked about. Remember, most of the health problems we have in Madison County are based on things on disease states such as hypertension and diabetes and all these things that an internist would be very helpful in working with Dr. Perkins and the other providers on attacking. If we want to do things like lipidology, if we want to do a cardiac rehab program, all of that, an internist could be a key person in that. Our problem right now, as everyone knows, is money. I'd recommend we hire this guy yesterday if we had money to do it. So it's going to be difficult when we're already having difficulty contradictory to what we're attempting to do to allow such an opportunity to pass too. Even if we find another position that we think well of, it's not likely that other physician would be an internist. So it's just a heck of a situation for us to be in, but we have no money. One of the things that I'm hoping that will help clarify the situation a little bit is what might happen with the county and that $250,000 indigent care subsidy. That might help us understand this a little better. Also, too, just FYI, it's strictly anecdotal, and that is that this looks like it, and Patrick may disagree with me here too, but to me it looks like it might be a pretty good fiscal year coming up compared to this year, because we may get that $250 in indigent health care subsidy. We will likely get more money starting to come in from the IT transition and electronic medical record stuff, and also too our rates for Medicare have gone up. That might equal between $300,000 and $500,000. So it looks as if we look at this cloudy crystal ball. It looks like if we were looking a month from now, 6 weeks from now, we might be able to see our way clear to affording Dr. Robinson. As we're looking at today, we don't have any money. The wallet is empty. So that's kind of our situation. It's not a good situation. For the people of Madison County, it's not a good situation.
I just have a question about, here we're talking about a physician, and he's talking full-time, right?
Yeah.
Okay. And we have several doctors in this town that are on the verge of retiring.
Right.
I wonder if he's had the opportunity to sit down and talk to some of those physicians to see if perhaps he could come into their practice. I mean, that's, in the past, that's happened quite often in Madison. Dr. Bibb came here and came in with Dr. Royce Jackson years ago.
Right, back in the 60s.
What?
Over 40 years ago.
Here's the problem. Here's the problem. There are a couple of problems. One is a political problem. I'm not so sure the medical staff would welcome. Dr. Perkins may have better insight than I do on this. I'm not so sure the rest of the medical staff would welcome another physician in, especially into their practice.
Unless Dr. Bibb would be the right one, I could imagine.
Right. The second problem is that in a poor community, a physician, again, Dr. Perkins can answer this much more eloquently than I can, but in my viewpoint, a physician will look at that community and decide whether he or she wants to give it a try. We're a very poor community. However, if you come into a community and you're employed, then you're guaranteed your salary, and that salary will be on a par that they will make if they were to be employed in an urban area. Is a reasonable statement, Dr. Perkins?
Yeah, because I've had a talk with Michael Forstapel, and he's been threatening me to leave David alone because he wants him back. but David doesn't really want to go back into Southern Medical because of he wants some more rural type setting there. It's a lot of the more you work, the more you get. Okay, but I'm not saying David wouldn't want to work hard, but he just doesn't want to back into that scenario of running an office and he wants to just practice the medicine and leave that to somebody else. That's my feeling, and I've talked to him several times about this, and it's my feeling that we're about top on his list of something he would want to do. I could be off, maybe he worked hard for number one, but we're pretty close to being there.
So going to a rural area is great, except there's no money. But if you can go to a rural area and be employed, that's good. So it's not quite what you
In other words, the old days of hanging out your shingle
Like
are not very anymore.
not so much.
I wanted to mention one thing on the $250,000, just based on the conversation I had. We talked about visiting Homerville with Charlie back when. We've seen what a nice job they did building that new critical access hospital there. I talked with But no, it won't be.
They
Because,
have operating room. I
hey,
remember that.
well, one reason it's not as nice is they didn't even plan for the
Cost report stuff.
for the cost report to get the maximum Medicare reimbursement out of it, which they told us, well, no, we didn't think about that. But anyhow, my point is that even back before they got the new one up and running and all that, and this is going back a number of years, I was talking to someone who used to be associated as a contractor with that hospital. They were getting, as he remembered, and this is, like I say, going back maybe 8-10 years, $500,000 in county support back then towards their indigent care. So we're probably one of the only counties around South Georgia, north, or into Florida in critical access that does not get indigent care support.
And one of the poorest counties in the state.
Well,
Well, that's the reason we don't get the support, probably. But we've got to overcome that. That's one of the obstacles we have to overcome.
Back to the 250,000, if this passes, how soon would that money be available?
Like I said, I would think it would take a while because they got to restructure everything, so.
Probably a minimum of 6 months, wouldn't you think?
Okay.
Something I'd like
Sure.
to say. We're still on Chief of Staff report, just to let you all know that Margie Faust McLeod, she was the board liaison to attend medical staff meetings, and she hasn't been able to attend those meetings, so we really would like someone from the board. I know that we are very busy, and we're talking about another meeting, and it's a volunteer position. But we meet again on July 5th at 6 p.m. in the dining room.
Which quarter?
Every quarter. January, April, July, October. It's always the first Tuesday of the month following the quarter.
I probably haven't do that. Just quarterly.
Okay.
No, I'm thinking that once school starts back in and
know what you were
schedules with children fall and.
Thank you.
Okay.
I'll send you.
If you see on the given quarterly that you will be out of town and we want a board member to attend, I will be your surrogate. Thank you.
Thank you very much. That's all.
Okay. Dr. Perkins, do you have anything else for us? Okay. Next board meeting is set for July 23rd, 28th. 28th.
Where are we going to hide out for that meeting?
We have to hide out back in our dining room, I guess.
That is so offensive. That is so terribly offensive.
It was.
I don't think Annette heard that.
I'll repeat that. It's worth,
Yeah, it's
it's
worth
worth
hearing
more
again.
minutes.
It made my day.
I had a visitor in the office. He's an old veteran, and he came in and taking care of some business, and he wanted to just sit and talk. I said, listen, I really got to go. I said, I got to go to a board meeting. He said, what board? I said, hospital board. He said, oh, you on that board? I said, yeah. I said, yeah. He said, well, we're meeting down at Lee today, so it's going to take me a few minutes longer to get to the meeting. He says, I tell you why they're going down there. I said, how's that? They hiding out so nobody will know what they're doing. I said, no, that's not the reason. I said, we're going to be visiting each neighborhood, each county, different cities in the county so that, we want to connect with each community. And he said, no, they're hiding out. They're just trying to keep everything undercover.
Just makes you proud, doesn't
I
it?
said, this thing is deeper than I thought it was.
Makes
This
it all
is
right.
another
How
prime
deep it
example of
is.
what I was saying. I mean, you could hold it on the courthouse steps, and there's gonna be individuals that are still going to find something wrong with that. That's
Yeah.
why I say the more community involvement you get in every step of this hospital, the better off it's going to be for the hospital.
That's stupid.
I'm not going to repeat
But
that.
the good side of that, and to show you, that's where his mindset was, but his wife said this, and she says, listen, that is a good thing. She said, you tell those people over there that we need that hospital. And she says, because they saved my life. That's what his wife said. But he was saying the one thing, and she said the positive. You know, said she's been over there for stroke, for heart attack, and Madison County for hospital saved her life.
Maybe that's what he's mad about.
Now that's offensive.
I didn't get to watch it this morning because I went into work early, but on the 7 o'clock CBS News, they were, and I'm going to see if I can find it on the internet, they were doing a report this morning on what the state of the economy and everything and the financial straits that your small rural hospitals are in nationwide, and how communities are losing their hospitals and the desperate situation it's putting the people in those communities into without having a hospital there. So I wish I could have stayed home and watched the program, but
What was it on?
it was on CBS.
CBS, I just wanted Lynette to hear that.
Talking about
She might
that,
wanna look
did
at
you
that.
all see the one about the guy going and robbed a bank?
Yeah, robbed a dollar.
Yeah, went and robbed a bank and told the clerk it was a bank robbery, and but he only wanted her to give him $1, and she gave him $1, and he went over and sat on the bench and said, when the police come, tell them I'm going to be right over there. And so when they get there, so why would you do something? She said, because I got a medical treatment, my insurance is expired, won't pay for it. If I go to jail, I can get the treatment.
And they'll
And he
feed
really,
him
he
too.
really said that?
Yeah.
Golly.
So he's figuring he'll get 3 years, and he says he'll be cured.
What
His
is he?
life up against the bank robbery.
Three swears.
There are a lot of your repeat offenders that purposely get caught the next time around because they have been taken care of, they've been accustomed to that environment, and they can't handle the outside. So they want to go back and be a ward of the state.
I heard an inmate tell an officer that one time. He said, "What are you doing back here? You just got out." He said,
It's tough.
"Boss man, it's tough out there." He said,
At the
he
work
said,
program.
"I come here," he said, "I get 3 meals a day, a nice place to sleep, clean clothes." And he said, "And when I got back, they gave me my old job back," which he worked in the nursery, the plant nursery.
But this guy had worked, he had retired, and, I mean, he worked all his life.
His insurance was gone though,
His
right?
insurance was gone. He just couldn't afford it.
I wish we had some residents of Lee here today. Sad.
I was disappointed.
I live in Madison.
I was disappointed, but I know Jacob lives down here, doesn't he? Lynette? Thought maybe Jacob might join us, even though you were coming.
I think he had something else he had to go to.
Yeah, he probably had to go to O'Neill's and eat lunch. That's what he does most of the
Likely story.
And Annette, you just got back from vacation, right?
We got back from Hawaii Monday at 12:30, and we fly out tomorrow morning to go to Cooperstown with Jacob to play baseball.
Oh, okay.
And 2 of his games are going to be on TV. It's going to be what counts.
Great.
All right. I was just noticing your dress, and it's kind of like Hawaii.
It was actually made in Hawaii. that is exactly why I told my husband I really need it, because it's actually made in Hawaii.
Good, as long as it wasn't made in China.
Okay. And you can look at the tag, made in Hawaii, USA.
That's great. Okay, announce the next board meeting?
Yes, you did?
Yeah. You didn't hear it?
Yes, I said yes, you
Okay.
did. I was affirming you, Mr. Chairman.
All right. Do I have to have a motion to adjourn, or can we just adjourn?
You need a motion to adjourn.
Need a
I so
motion.
move.
So moved?
Second.
Motion second. All those in favor? Aye. We're adjourned. It's 1:32 and a half.
bought a visor in Mexico on a cruise a few years ago, and I couldn't believe it. I looked at the tag. It was one of these that's got a shark on it, and when you get in the sunlight, it turns the color. They're made in America.
Well,
Oh, wow.
I was trying to find some of the
Crazy,
wood
leading edge
carvings and stuff that are made